Hi, my name is Jeanie, and I had a knee replacement. The recovery just wasn't going very well, and so I needed more flexion. And so I researched online and found the X10, and it helped me a lot.
Hi, my name is Lisa. I'm a patient recovery coach here in Michigan. Jeanie from West Virginia gave our company a call, and she was in trouble. She's only getting between 75 and 88 degrees, and her surgeon says, we're looking at a manipulation.
I'd had such a hard time, and it was so depressing. The medicine wasn't right, the physical therapy wasn't quite right. The doctor told me, and the physical therapist told me, that I was going to need an MUA, Manipulation Under Anesthesia. And I had read about it, and I knew I didn't want it. They have to take you back in the hospital, put you under anesthetic, and manipulate that knee and push it to far as it'll go, one way and the other. And you wind up starting all over again. You have your swelling, you have to go back on opioids, and you have to go to the physical therapist every day for 2 weeks, and they have to push around on you and cause you all kinds of excruciating pain. And the doctor told me when I went in to see him for my 5-week checkup that he could do it, and he needed to do it right away. And I said, give me a couple weeks. I want to try this new machine, and I talked to him about it. I just knew I was going to beat that MUA. Within the week, they sent me the X10 to my home, and I could get started right away. It was just the flexion that I needed, and so we set it on 75 because that's where I was starting to feel a stretch. I used my own judgment with how my knee was feeling as to how high I wanted to go. And that was such a relief because at the physical therapist, they were always pushing on my knee to the point where it hurt too bad. I couldn't relax at all. And so this was such a change, such a difference. I had the machine 10 days before I went back to him. He said, you don't need an MUA.
It brings tears to my eyes. It is so much fun to help a patient. And we didn't know, her going into this, we didn't know that she was going to avoid a manipulation. We believe, and we have many times helped patients avoid manipulations. Together with the patient's hard work, the fantastic technology of the X10, the support of the coaching, but also the way the body responds. Those are all variables, and she beat it.
My husband was impressed with the machine. He's an engineer, and he looked at it and he says, oh, well, this is better than I thought it was going to be.
Her husband is having her knee replacement later in the summer, and he's getting the X10 because he'd like to have his full range of motion before 6 weeks. My guess is that within a 2-week period, her husband will have above 120 degrees within a 14-day period.
The physical therapist measured it, and with no pushing, pulling, anything, I had 121. And with your all's help, I avoided that nasty MUA.
I'm just honestly really thrilled that Jeanie came to us. She said, I was skeptical. She said, I didn't know your company. I wasn't sure if your company could help. She says, but I am really pleased.